Thank you for joining us. Welcome, everyone. I'm Sally Pace. I'm the CEO of Connect Healthcare Collaboration, and I'm thrilled to be moderating today's session. Missed care hurts your people and your budget. But you already knew that. That's why you're here. So today we're going to talk about how HR leaders and consultants can take a data-driven, proactive approach to managing both care and cost. We'll walk through some real-time insights, predictive analytics, and clinical navigation, and show how they can close costly gaps in care and help your people get the support they need when they need it. Today, I'm joined by three fabulous other speakers. And I'm gonna let each of you introduce yourself according to the slide on the screen. So Mark, I'll kick it off to you first.
Sally. Hello, everyone. My name is Mark Stevens. I'm one of the partners at Main Street Insurance Group. Looks like we have a really large audience here with us today, Sally. I'm excited to be part of this discussion and about rethinking risk and improving engagement. Glad to be here with you.
Thanks. Lauren.
Absolutely. Thanks, Sally. And thank you all for joining today. So my name is Lauren Robertson, and I'm a board certified nurse practitioner and head of advocacy at Connect Healthcare Collaboration. Our team supports employees and their families through complex care journeys.
And Paul, last but not least.
Hi, everyone. I'm Paul Richmond. I'm the Chief Commercial Officer at Wellnessity. And, we help benefit leaders, benefit teams see what's driving costs and the risks that are behind those costs, and then identifying the actions that they can take to head those off.
Well, let's jump right in and let's start with a stat that really should stop all of us in our tracks. Over 80%, according to recent surveys, 80% of employees are confused about their benefits. And that confusion isn't harmless. It leads to missed preventative care, unnecessary ER visits, and worsening chronic conditions.
Yeah, and that confusion isn't just on the employee side. HR teams often tell us that they have no idea where their spend is going until it's too late. They're stuck with lagging reports, vague dashboards, and next to no visibility into what's working, what isn't, and what actions they should take.
Paul, it's really no surprise. More than 70% of employers have about 5 to 10 vendor contact numbers in their benefit materials with little guidance. Employees are left to figure it out on their own. And that confusion just costs money. Let me share a personal story to kind of illustrate this. A family member of mine was recently diagnosed with breast cancer. I was faced with a decision between radiation and chemotherapy. Her employer was a large employer, had a major care navigation vendor, but she didn't know it. No one called her. She sent me her plan information. I had to dig through the benefit guide just to find the vendor listing. She never would have known to look. That's really the problem.
And Mark, I think that story does really bring into focus what the problem is. And when employees are left to navigate a fragmented system alone, because not everybody has you in their family, it leads to confusion and costly delays in care. But that isn't just an anecdote. The data backs it up. And we need to understand what the numbers are really telling us. So Paul, I'm going to ask you to walk us through how the data can shift our approach from reactive to proactive.
Yeah, I think it's helpful to orient around some of these numbers, though. 90% of employers are citing rising healthcare costs as their top strategic concern. There's $935 billion annually driven by unnecessary service, missed preventative care, and just inefficiency in care delivery. And we know this, but it's always helpful to state again, only 5% of the population are driving over 50% of the healthcare spend for all of these employers. Yet most employers don't see the risk until it shows up in the claims report after it's far too late for them to do anything about it. And that's where the predictive analytics can shift the game. It allows you to surface hidden risks before they escalate, giving the HR team or the clinical team a chance to intervene early. And we're moving away from lagging indicators to leading signals, which is the shift of, from retroactive reporting to real-time insights that allow you to respond to today's problems.
And Mark, you're working closely with employers on the front lines of all of this. So how are they responding to this shift?
So I want to get to your question in just a second. Paul, I'm getting a little bit of a muffle on your sound. If you could speak up a little bit, maybe it's my audio, but if any others are experiencing that, I want to make sure they're hearing all the good stuff that you're talking about. But Sally, to your question, what I'm really seeing is kind of a growing sense of urgency. I mean, employers know the old model of watching claims roll in and hoping next year is going to be better. It just doesn't work anymore. That top 5% who drive the bulk of the cost, the group is constantly changing. So if you're not spotting new risk early, you're always chasing last year's problems. So I like to frame it with the rule of 72. The rule of 72 is a back of napkin formula that estimates how long it takes an investment to double. That works for expenses too. So think about healthcare. At a trend of 7%, the rule of 72 says your healthcare premiums are going to double every 10 years. Think about that. That's crazy. But if you can bring that down to, say, just 1%, as we've been able to help some of our clients do, it nearly takes 70 years for the cost of those premiums to double. You gain decades of control. And that kind of change starts with early visibility and smarter decisions. That's the power of pairing predictive insights with timely outreach and trusted guidance.
Exactly. Healthcare is episodic. It's personal and it's emotional. When someone needs help, they need it now, and not the next quarter, not the next year. But most systems aren't built for that kind of responsiveness to the members' needs. That's why this shift to real-time insights and timely outreach is so important. It's not just to improve outcomes, but it also improves the cost control capabilities of a benefit team before those costs start to spiral.
And so that is, of course, the challenge and also the opportunity. So seeing those risks earlier is critical, but insight alone isn't enough. We all know dashboards don't drive change unless they lead to action. So let's dig into that next and talk about what it really takes to turn predictive insights into smarter decisions. And Paul, I'm gonna start with you.
Okay, so again, talking about numbers, I think it's important to highlight the benefit of being able to demonstrate the value of predictive analytics. We are able to drive significant savings, over $760 million annually in savings per 500 members per year, reduced 38.3% of preventative care, reduction in hospitalization risk, and then also 37.7% reduced medication adherence hospital risk. So those are real numbers that drive change. But whenever we talk to benefit leaders, they often tell us, everybody can tell me what my problems are. Nobody tells me what to do about that. And what's the insight without a next step? Nothing. That's just an observation. So it doesn't move the needle. And that's why it's important to go beyond just observations and reports, and why we built systems that go beyond that to guide action for the HR teams. We use predictive models not to just observe the problems, but to get ahead of them and show the teams what to do next. That might mean reaching out to a member with a rising risk profile. It might mean nudge them to use an underutilized benefit, or just flagging that member for a vendor to follow up with them. And that's what we mean whenever we talk about precision over volume. It's not about drowning somebody in dashboards or collecting more data. It's about making the right call at the right time before the costs hit. So when you go back to those numbers and you look at what we talked about, those outcomes aren't because we have more data in a sense, but because we were able to drive targeted, timely action. And that's how you stop looking in the rearview mirror and look forward.
So Mark, from where you sit, how are you helping employers turn that precision into better decisions and ultimately better outcomes?
Well, like I was saying earlier, the top 5% who drive the majority of the spend is constantly shifting. I mean, the key is spotting who's about to enter that group and then intervening early. So take specialty drugs, for example. We had one client with a $40,000 a year employee, meaning they pay them $40,000 a year, walks into a routine dermatologist visit, walks out with a Humira prescription. That turns that employee to about a $140,000 employee overnight. We stepped in and transitioned to a biosimilar at about $800 a month. That brought the total annual cost of that employee down to roughly $50,000. Still a little bit more than 40, but obviously not 140,000. Or think of site of care, a hernia surgery at a hospital. Let's say it's $34,000. Same surgeon, same procedure, outpatient setting, $11,000. But it's just not about the dollars. It's about the experience too. Did you know that surgeons prefer to work in an outpatient setting? They can perform twice as many surgeries in half a day than they can do in the hospital. Navigation starts at the point of diagnosis. Is the diagnosis accurate? Are we recommending the right provider, the right setting, and giving people the right questions to ask? One woman we supported that was diagnosed with melanoma, her surgeon said, "We deal with this all the time." You know what her response was? She said, "Yeah, you may do this all the time, but this is my first time." She needed a guide, someone to help her understand what came next, ask the right questions, and make confident, informed decisions.
And of course, the idea that guidance starts at the moment of diagnosis is so important. But of course, that only works when we reach people in time, which brings us to our next point, how predictive analytics can act as an early warning system. So as we look at this and move to this next slide, we talk about the idea of the guidance at moment of notice or moment of diagnosis. But for that kind of support to work, of course, timing is everything. So, Mark, from your experience, what does it really take to move from that reactive support to timely, trusted intervention? And where do you see most employers falling short here?
Yeah, Sally, timeliness is everything, right? And the key is trust. And trust doesn't just happen in crisis, it's built in advance. So, employees may ignore a call from an insurance carrier. It feels transactional, like it's about protecting the plan, not supporting that person. But a call from a nurse they know, from someone who's checked in before, who's guided them in the past, they answer that call. That's the difference. And when that trust is backed by technology, triggered with signals, real-time alerts, you've got the timing and relationship working together. That's when outreach really works. It's relevant, it's human, it's actionable.
Absolutely. And of course, speaking of nurses that can be trusted, Lauren, our team is doing this every day, using these predictive signals to flag risks before they escalate. So can you share how you're turning, and you and the team are turning those insights into timely action?
Absolutely, Sally. So both Mark and Paul have provided some really good details and insight about building trust and about grabbing the data when it actually means something. And so what our team does is that very thing. We rely on those real-time indicators and prioritize our outreach efforts. So we're focusing in on the right people at the right moment and not weeks later. So a real-time example, we've been trying to connect with an individual who was a member on the healthcare plan, and she was on an expensive specialty drug, but she had never engaged. And so people are willing to engage when they've actually got a problem, something that's plaguing them, something that's stopping their care in its tracks, and they need help. So this member's medication was denied at the pharmacy, and that's when she reached out to our services. And to give a little background, and you probably can relate to a circumstance like this or have a family member that did, but she'd been trying to figure out why her medication was denied and working along the pharmacy team for over a month and was getting nowhere. And so what our team was able to do is get it resolved within a week simply by educating her and walking her through the copay assistance program. There were 2 different enrollment opportunities that she had to take advantage of before the medication could be approved. Contact the physician office, talk to the prescribers, let them know what was missing, what was needed, connect the dots for her. And that's what you need somebody to do, somebody who knows how to speak the language as a clinician, and knows how to connect the dots for the employee and has reached out to them before to establish we're here to help. And so what we were able to do is get her that medicine. She could stay at work and feel great. And what did that avoid the employer? A 6-figure cost to the plan for only 6 months. So what does that tell you? Far larger for 12 months. So that's the power of predictive insight and timely human touch in the right moment.
But I think every single one of us on this, on the panel at least, have heard our carrier already has nurses. So Lauren, what makes this different?
Absolutely, Sally. So again, it's the predictive insights. So another example, real life example, we were working along a payer group that had a team of nurses. And so with our predictive insights, we had an outreach list that told us to call an individual that had recently had a knee replacement. So we did just that, called in, had a knee replacement. He was actually going through post-surgical complications and shared with me on the call that he had been contacted by the payer nurse for 3 months, every 3 months for asthma, had not experienced asthma for over a year and was ignoring the calls and didn't know why and continued to get called. But what we were able to do in the call we had with him based on insight and predictive analytics was to connect him back to his surgeon to avoid an ER visit. So that's what it tells you about not just checking the box. Outreach needs to be neutral. It needs to be clinically focused with someone who knows, again, how to speak that language, who knows that how to work with the physician office, how to work with the patient. And we're therefore more likely to engage with you if those are the things that you can provide. And that engagement is timed right when it's combined with the data.
So let's dig a little bit more into this and let's talk through this slide, Lauren.
Mm-hmm. Yeah, absolutely. So predictive models are only valuable when they drive action at the right moment. And again, that's what we focus on. We reach out to those members at inflection points when the decision is needed right now. So we use those real-time indicators and prioritize the outreach efforts. So another example I can give you is a member who was trending towards a hospitalization. So our nurse team reached out, intervened just in time, connected her right time, right care, avoided an escalation to the hospital, and helped her manage her condition safely at home.
And that really is powerful. But a lot of teams have access to data, not diminishing the story, but they have access to data. So what makes this different? How are you turning that data into something that the nurses can actually act on?
Again, it's about the right timing. You again don't want to get in touch with somebody who you spoke to over a year ago about something that's not plaguing them or even a problem in the moment. So another story that might provide some highlight to you and let you know what the things are that we deal with. We had a member with rising claims tied to a diagnosis code of obesity, morbid obesity. And so basically what happened is we reached out to this individual, and the reason her claims were so high tied to obesity was that she had had a bariatric surgery, so a weight loss surgery. And so this member had experienced severe abdominal pain seen in the emergency room. And ultimately, what she was told in the emergency department visit was that she had possible kidney cancer. So she was connected to a specialist at that time, but the specialist network could not see her locally. They were far too small. And so they recommended she go to an academic facility. So what happened is the academic facility never got her referral. So when we spoke to her that day, we were able to educate her on the awesome program that her employer had, which is a Center of Excellence program. We got her connected to a Center of Excellence facility who performed her care at Mayo. She received an excellent surgical outcome. She continues to do great. And now that she's in remission, we still talk to her, have a great relationship. And she actually said on the phone, I'm so glad that you called me the day that you did, because the day that you called me, I'd actually thought about committing suicide. And that's the importance of building strong relationships with people and getting to people in the right time that can make a difference in their life.
Absolutely. And that is that timely, high touch, human touch. But of course, I know, Paul, not only from the human touch side, but this kind of real-time responsiveness is a major focus for you too. And so from Wellnessi's perspective, how are you helping employers use timing as a true strategic advantage?
Yeah, so Lauren's absolutely right. Timing is everything. The problem though is most of the tools that employers have, they just get reports and information after the fact, sometimes to Mark's earlier point, months and months and months after the fact. But the decisions that shape the outcomes and the trend and everything that they're talking about, they happen in real time. That's the moment we have to reach. And that's why we built these systems to do exactly that, delivering the proactive prompts that alert the right teams before the cost spike, before the care is delayed, and before they go to vendors who underperform. When HR leaders and clinical partners can act in the moment, not weeks or quarters later, that's when real change happens. And we're not just surfacing the data, we're actually ingesting the data in such a way that we can build workflows around that data and route the information to the right players. so that they can help get the person who needs care the right care when they need it at that moment of need. And that's what makes that kind of intervention scalable and sustainable that Lauren was talking about.
And Paul, what you're talking about too, that shift from passive reporting to real-time action also sets the foundation. We all know this for something even bigger, which is a smarter benefits strategy. So let's turn to the next slide. And there it goes, it advanced. So Mark, I'm going to turn this back to you. Let's bring this back into the benefits consultant benefits space. For years, employers have certainly tried to control costs, mostly by shifting it to the employees, which is not a great strategy, but we know that isn't really working. And can you tell us what you're seeing with employers who are taking a more proactive approach here?
Sure. And Sally, I mean, for years, the go-to strategy has been cost shifting, raising deductibles, increasing out of pockets, and narrowing networks. We used to do focus groups with our employees, and in those focus groups, these employees know what's happening. I mean, the cost is being shifted to them. But here's the real truth. That hasn't solved the cost problem. Costs are still going up. If anything, it's made it worse. It erodes employee trust, delays care, and ultimately drives up long-term spend. But with the right data used proactively, we can flip that script. We can invest a little smarter up front to avoid bigger costs down the line. Here are two world examples. I mean, one employer dropped primary copays to 0. Result, more preventive care visits, fewer visits. And I always find it interesting that we want to look at utilization reports and we can tell that somebody's using the ER on a Sunday at 1 o'clock. That's not a solution. Another gave away maintenance medications and covered physical therapy at no cost sharing. That avoids surgeries and reduced opioid use. And here's a powerful one: real-time admission, discharge, and transfer alerts, ADT. We had a behavioral health case where a provider had no idea their patient had been in the ER for a psychiatric crisis the night before. But because of ADT, the admit, discharge, and transfer alert, we're able to flag that person and immediately recommend that person to care before they fell through the cracks.
Okay, those are really tangible examples that you just shared. But I imagine that kind of shift, going from reactive to real-time strategy, also requires a mindset change. So, Mark, how are you helping those employers make that leap?
Well, it really does start with mindset. I mean, you have to believe that spending a little bit more strategically today can save a lot more tomorrow in both dollars and in lives. I mean, that means giving employees easier access to the right care at the right time and trusting that better access pays off in the long run.
Yeah, but Mark, that kind of strategy only works when the data is connected, right? You need one place to go to see what's happening, what's working, what needs attention now. And that's the shift that you're talking about from passive reporting to active management of the health plan. It's about using live data and those predictive triggers, real-time visibility to make the benefit strategy dynamic and not static. You know, that's how you stay ahead of risk and improve the experience along the way.
Definitely.
All right, so let's talk about moving from patterns to people. Paul, how does this scale? What are you seeing when employers embed this kind of strategy and outreach across their population?
Yeah, we have one customer of ours that comes to mind immediately. That's a great example of this. They have 5,000 employees, and just one quarter, we were able to identify members of interest that triggered 589 personalized interactions with these targeted members through the CHC's outreach program. This was true high-touch engagement. The nurses initiated calls, texts, emails, virtual meetings, and in some cases, even handwritten letters. And those turned out to be breakthrough moments. Okay, so what's the impact? The impact of that was 100% of the members of interest that were identified were proactively engaged for a savings that we validated for $166,760 just for the quarter. And if you annualize that out, we're talking about over 600,000 in annualized savings, which is a 4.15x return on investment. So it's not about the volume and just communicating to everybody. It was hitting the right people at the right time, and the return on investment was huge.
Lauren, give us a little bit more of a breakdown.
Yeah, absolutely. So again, it was it was the letter writing campaign that actually elicited the best response here. It was that personalized approach. We had done a number of outreach attempts, and a lot of times I think it's the static of the emails. And so you try different strategies to make sure that you're getting to people in a way that they can hear it and engage with those services. And it was the letter writing that did it. So this individual reached back in, and several people actually did based on the letter writing campaign. And we were able to make those connections, get people to the medicines they needed with a very personal approach, kind of old school, we can call it, but it worked, and it worked for the member and it worked for the health plan.
Absolutely. And, Paul,
Yes.
you saw it firsthand.
Yeah, and that's what I love of the ripple effects of this type of situation. The VP of benefits there told us that they're using the cost containment strategy, the funds that they saved there, they're reinvesting that in programs that support better employee health and well-being. So it's not like the company's just pocketing these dollars. They're reinvesting those into their people in ways that continue to improve health and make their experience better. And that's the goal, right? It's turning the data into better outcomes and long-term value for the organization and the people.
And then you're really describing the power of timing. So, Lauren, do you have any other cases you can share?
Yeah, you bet. So basically, again, personalized outreach, personalized approaches. So when you get stuck in a loop, you got to kind of think outside the box. Like, what do I do to get these people to engage with our services more, to do something for themselves that's going to be impactful? It's going to help them better at home and for their employer. And so basically, we were, again, that patient assistance program, we get a lot of calls about that because those drugs are high dollar and they need them to live their life normally. And so basically, we were able to step in one scenario where there was a member that was, again, on a high cost specialty med and was having a hard time getting that covered and didn't understand biosimilar opportunities, other alternatives to that drug. It's not just that one. There's lots in that class of medications that you could discuss with your physician. So it's giving people the option, telling them there are options, letting them take control of the options that they have available while helping them and helping the plan. So that's how you build long-term trust with a long-term partner in their complex care journey.
And let's look a little further at these moving from patterns to people. And Paul, I'm going to come back to you because the stories we just heard really do show how this is possible at the individual level. But what happens when you scale that kind of proactive approach across a national population? Can you walk us through a different example?
Yeah, we have one national employer that has roughly 50,000 employees, and we have a proactive outreach strategy in place where we can reach people before their high cost events happen. So in 7.5 months or 7.5 months, the program delivered both measurable clinical outcomes and financial results. Roughly 5,000 potential cases were flagged, which is about 10% of the population. And from there, we had almost 1,300 members flagged for outreach, but we got nearly 1,600 members reaching out to us through inbound leads, right? So 125% engagement there, which is a huge win. And that just shows how strong that pull is whenever the support is timely and trusted, because the members start reaching out more. So we had 83 of those cases referred out for clinical support, and then we had 15 that were completed and receiving care. And on the financial side, that resulted in a little over $2 million in estimated savings. That's the power of the predictive insights and targeted human engagement, not just triggers. When outreach is personalized and actionable, it drives not just participation, but faster access to care, better outcomes, and real sustained value for the employer.
Yeah, and it's such a powerful reminder that when outreach is smart, timely, and human, it doesn't just improve those outcomes, it really can transform the entire cost curve. So let's talk about how this shift is changing the way employers think about benefits, not just as a cost center, but as a strategic asset. And I want to invite each of you before we wrap up. I know we're getting close to the Q&A section, so audience, you need to start thinking about what you want to ask this fabulous panel. But before we wrap up, I'd love to hear from each of you. What's the one insight you want the audience to remember? Paul, I'm going to start with you.
Yeah, so I'd have to say that smart data isn't about reporting. It's about transforming experiences and outcomes, and visibility drives action. You can't fix what you can't see.
Mark?
Well, what we're dealing with is healthcare and insurance. Both are complex and both are very expensive. You're never going to turn your employees into experts. You can guide them. Trust is the key. When people feel supported, they take action. A little while ago, Paul talked about 100% of the members of interest that they were interested in engaged. And only data allows you to engage early. And early is where the biggest ROI is. And that's where the results are.
And Lauren, last thoughts before you open to Q&A?
Absolutely. The navigation works when it's clinical, timely, human. Early matters. The sooner you intervene, the better the outcome. And personalized support is powerful because you're able to build trust, engagement, which ultimately leads to good cost control.
Absolutely. All right, I'm going to move to the final slide, and it looks like the audience has followed the instructions well. We've got some Q&A coming in. Let's see, the first one is, this is a great one. Have you ever had an employee become upset that you reached out to them? Lauren, I'm going to turn this one to you about health-related information that they thought was private. And how do you balance that?
We always educate the people that reach into our services that what we're here to do is to navigate people to all the benefits on the health plan. It's not that we're strategically targeting you personally on the call, but what we're doing is here to educate you on all the benefits that anybody in your employer group can take advantage of at any point in time. It could be now, it could be a year from now, but the point is to just educate yourself so that when those circumstances arise, step in and take advantage because your employer is trying to take care of you.
The next one, Paul, I'm going to, from an analytics perspective or analysis perspective, are you looking at optimal nurse to employee or member utilization?
No, we don't really tackle that number. That's going to be a function of all the different parts of the ecosystem. I know Mark and Lauren probably have better perspective on that in terms of how they staff that because they run teams that do clinical navigation. But from our perspective, it is important to make sure that you have somebody who can reach out at the right time whenever someone has a need.
Yeah, I can add a little bit to that. You know, these connections are, there's different levels of complexity, you know, for some of these encounters. Could be, hey, you know, I need to find a high quality provider versus I have a new diagnosis. So those are two completely different things. And so the numbers we kind of, I think it was Greg, I think the numbers that we work off of is, you know, a nurse over the course of a year could probably engage with about 500 people during the course of a year. And the way I think about that as far as how many people in a population actually need that help, well, about 10 to 12% of the people in your population are going to need that help. So if I kind of work those numbers, a nurse is probably, Lauren's going to kill me here by saying this probably, but I mean, that would be a population of about 5,000 employees. But of course, only 500 people within that group is probably going to need that help. So, Lauren, please correct me if I'm off on that.
Yeah, gosh, Mark, I don't know what kind of model you're running, but no, Mark, you're right. And Paul's right too. It really is about the ask. So what is the ask of the nurse for the group? Is it to handle any and all things, or is it to handle a more predictive, proactive strategy? And those are two different pricing models because it is based upon the number you can care for by the level of the ask. So there's a couple of ways you go around it. It would just be about looking at the data and understanding what's the true need of your population and where do you want them to have the best, most efficient access to the care benefits that you're offering to them. And so there's a few ways that you can dive into it, but that's typically how we look at it. What's the ask? What does the data show? And what is it you're wanting us to target for your population?
Another one has come in, and I think all three of you may have a similar or very different answer. So I'm going to start. We'll go Paul, Mark, then Lauren. Is there a minimum group size you work with?
From our perspective, there's not really a minimum. We just think about each engagement on its own merit, and we'll price out based off of the work that we're being asked to do. And we do get to a point at which the cost becomes very linear with the size of the employee group, but You know, we could definitely have that conversation offline with the person that asked
Okay.
that in our services.
Okay.
I think that's a fascinating question, Sally. You know, before we built this model at Main Street, we went into this with the idea that these big vendors and their pricing model, they're not affordable until you get to about 5,000 employees and greater. So we wanted to bring this down to any size client. And because of our relationship with Wellnessity, we actually have clients that are 50 employees. And they have the same pricing as our larger clients of 2,000 employees. So we really wanted to make this affordable for any client that could and wanted to benefit from this. So I think that is actually one of the strengths of what Wellnessity has created, is to be able to bring back down an affordable model to any self-funded employer.
And I think you just hit the nail on the head about it. It is the self-funded space where we really can all collectively move that needle. We've got a couple that have come through on the chat side. And let's see, I'm going to go, the first one is, what outcome should HR measure to prove ROI on navigation? Mark, I'm going to let you answer that one.
I knew you were going to come to me first on that one. I really don't like the ROI question. There's so many vendors and that are out there, and there's so many solutions. If all of those solutions realize their ROI estimates, those promises, healthcare would be free. I mean, but I like how you phrase the question, is like, what outcomes should you measure? I mean, number one, are you identifying healthcare opportunities early enough to do something about that situation? That would be obviously pretty important. I mean, through navigation, how many people are you reaching? I mean, kind of like what Paul said, 100% of members of interest engaged. Think about that for a minute. That's incredible. I mean, the insurance carriers are what, low single digits, something like that. I would say ours is more like 98%. I mean, ours is built around trust. And when you establish that trust, you're able to get to those members. That's a very high level of engagement. We want to measure that. And then from a dollars and cents standpoint, I mean, how much are you actually saving? I mean, you definitely want to know that. I mean, the approach is help people with this very complex and expensive healthcare situation, then use our insurance knowledge to be able to, whether it's a pharmacy solution or a place of service or whatever the case may be, then you can look for savings opportunities. But you do want to measure that, because at the end of the day, what we've been able to do with many of our clients is average a 1% trend on their claims. So the other thing I didn't mention is, in the first year of engagement, their claims go down 6.5%. There's a tremendous amount of opportunity. From a cost standpoint, you need to measure that as well.
And then Lauren, the next chat question, how long does it take to plug in navigation, and what time during the plan cycle can you do it?
I mean, can we start now and plug us in at any time? We work alongside Wellnessity, and what we're able to do is go grab historical claims. We onboard the advocate that's going to be responsible for the group, and typically it could take anywhere from 2 to 4 weeks, but we can start yesterday and ready to go tomorrow.
Perfect. And then Paul, last question that we're going to have time to answer is, what challenges should we expect with data integration?
Oh, you gave me an easy one.
We're going to end on that high note.
So
Get to a positive.
getting the data has been a challenge for almost everyone in the space. And part of the issue has been where the company that was requesting the data, what they're positioning in the benefit ecosystem that caused the trouble, right? So advisors, they're very often looking to benchmark across their entire book of business and make big recommendations. Point solutions are often set up to try to carve out a piece of the spend, or redirect it in some way. And really what we're doing is we're operating on the behalf of the health plan to just better let them manage their spend. So because we're an operating platform for the health plan, we can just work with the companies, ensure that we're not going to share data that they don't want shared with other players in the system. And we're not trying to carve out spend. We're just trying to help members engage early. So really it boils down to like kind of the positioning of us, where we are in the ecosystem and the purpose of the data. You can expect it to be an effort, but our team is very successful in going and getting the data to date. Knock on wood, we have not come across a major carrier or PBM that hasn't been willing to share the data after we've explained, our services, what we're doing, and the purpose behind the asks.
And we are going to have to end on that note because I know we're up on time, but we hope that we left you in the audience wanting more. So I want to encourage you to pull out your phone right now, click that QR code, or email demo@wellnessity.com for a free, there's no fleas, they're free plan performance assessment. And this will include a design analysis to help uncover your cost drivers, care gaps, and improvement opportunities. So with that, we thank you for sticking with us today. We hope you got a tremendous amount out of this very valuable and timely session, and we hope you have a great rest of the day. Thank you all.